Donor is a local company. It's established in the UAE, and it is addressing a very simple problem: the transformation of healthcare. Today, the future of healthcare is upon us, and it is nothing like what it used to be before. The future promises that actually we would be able to, quite literally, conduct all of the healthcare tasks, which are divided into 4 categories, and do it from the comfort of our home with certain sensors. So that's the part related to diagnostic, the wearables and specialized sensors delivered to home. We can do today the consultation using telemedicine, e-treatment, so the delivery of medicine in a verified way to ensure that the right medicine for the right patient is delivered to home and charged instantly to the insurance, and the insurance pays the provider. And finally, give also equally instant feedback to the manufacturers and the healthcare authorities, all with the use of technology. We're only focused on 2 segments of those, so we're not focused on the telemedicine or the diagnosis, but we're focused on the delivery of the treatment in the right way to the right patient at home. And we're also focused on the feedback part in the healthcare. Why is that a big thing? Because as we stand today, 2% of all medicines are actually counterfeit, and this is a growing trend. And 100,000 people are affected by that around the planet. 100,000 deaths are happening. 3% of the inventory is being diverted from the market where it's intended to another market, either due to a financial gain or where a product is priced differently, lower in a certain market versus another. There's 3% fraud in insurance as well, and if you ask any manufacturer of pharma, they will tell you about 10% of their inventory is recalled due to near expiry. So today, with our solution, we expect to address all of that. This is a problem that is faced, all over the world, and all of the governments are actually taking action against it. In the EU, as of February 9, 2019, the law has been put in place that every single medicine needs to have an anti-tamper device to ensure that there's no counterfeit. In the US, there's a pilot being planned as well for a blockchain for every single medicine pack produced. And this is for 2023 rollout. But both of these solutions only look at B2B. So from the manufacturer down to the provider. We decided to actually come up with a disruptive solution that goes B to B to C, applies blockchain for the log of medicine disbursement, but equally have the anti-tamper NFC device built into the solution. So for instant verification of medicine and instant verification of the patient that is the right medicine for them. By doing so, we generate about 40,000 times more data, and that data becomes actually our facilitator of services for the providers. So we can add a lot of value simply by applying the data of how much consumption is happening, what are the different spikes that are happening, how much feedback is coming from users on certain medicines and what have you. So what is the breadth? Where are we really monitoring? We're monitoring across the whole ecosystem, from the start, from the manufacturing side, down to the consumer side. So what we mean is that the NFC tags are actually implemented, the anti-tamper tags are implemented at the manufacturer level, and then and then tapped across, up, down to the consumer. The application is quite simple. It consists of 4 modules. One module is about the medicine condition, so that's the tampering of the medicine. It's a special design as per the EU standard. The second module is the patient verification, so the integration of the patient ID with the e-prescription, with the e-claim, but then the e-delivery. the delivery of the medicine directly to home to the patients. And this is the component that we're bringing on board. Finally, the track and trace IoT sensors to have it across the whole supply chain to make sure that the product were not exposed to a heat load that makes it no longer good for use. And all of that log is built onto the blockchain, so therefore, there's no way for somebody to falsify that data. In summary, this is a quick demo. I would invite you, we'll share our contacts at the end, but I'll invite you to actually come and see the demo. It's quite straightforward. It applies the NFC tags. It looks at heat load, tempering, insurance, feedback, e-prescription, and it quickly gives you all the information related to the medicine. It gives you the number of taps. It allows you to give feedback and the whole lot just from a tap of the medicine. The market size is quite significant in terms globally. It is estimated around $55 billion will be going towards NFC, anti-temper tags, and track and trace. It's not going to only be implemented into the healthcare. This is the first application that we're having, but it's going to be applied across many products that you can think of. And I'm not going to dwell on that. Where are we at today? So we were lucky actually to be incubated here in UAE, participating as part of AI Microsoft to look at how we can integrate AI into that application. And we launched our product with the telco operator in January at Unlock. So that was a partnership that we signed, and we're happy today to announce that we also have our pilot finalized for pharmacovigilance in UAE in partnership with the health authorities. The services that we would deliver to the healthcare industry are selling the NFC tags at the manufacturing, or it can be applied later. The service, which is a subscription with the pharmacies and all the healthcare providers. A value added, which is the data that we collecting that is actually turned into insights on when will there be an outbreak of a cold or a virus, a certain virus in UAE. How can you anticipate it? If there's a problem with a natural disaster, how can you quickly, the government, identify who's still alive in that affected area and deliver medicine to them from the application? And that's the emergency part. In terms of our financials, we have a very healthy bottom line. Our margin is about 83%. Our partner, Do Telecom, we signed the agreement with them, and they would get about 20% of the margin. And basically, we're expecting to be profitable from the first year, break even, and repay all the investment by year 2. This is our roadmap going forward, and we hope that we find the right partners to team up with us and take it to the world. I thank you very much for your time. I'll quickly introduce the team. Myself, I'm Wasim Merabi. I'm the CEO for the company. Dr. Marwan Zaraouni is our co-founder and partner, and he's responsible for strategy and technology. Oh, sorry. Yeah, thank you.